Hello, everybody. It looks like we are officially live. Thank you for tuning in to our town hall about interacting with the medical system. While we wait, we'll give a little time for everyone to hop in. Please do let us know if you're here, where you're from. And then we always start, we're from the Chronic Illness and Disability IOCDF Special Interest Group. And in all of our special interest group meetings, we start with a would you rather. Tonight's is a very serious one. Would you rather be a ninja or a pirate? So would love to hear your feedback in the comments while I ask the group. Mary, you seem like you know. Oh, we got it up there. Yeah, Mary, ninja, pirate?
Hi, everyone. So good to be here tonight. I guess to answer this, would you rather? I'm gonna have to go with pirate. I love to swim. I love that they live their lives on the sea. I'm gonna stake my claim on that one.
All right, we got KP saying ninja. So we got one ninja, one pirate. Megan?
Yes, I would also choose to be a pirate because I like being out on the water, but I might need to be a pirate who brings along some Dramamine or anti-nausea meds.
Perfect for this stream. We got
Yes, exactly.
Cash is going out of the box with a samurai, which was not an option, but I like the creativity. Sandy? Sandy, I think you're delayed a bit. Can you hear me? You are also muted. Does anyone else hear her? Okay, yeah, Sandy, I can't hear you. While you're fixing that, I'm going to go to Jake.
I'm also going to be Team Pirate, just because if you're a ninja, no one can see you, right? Like, if you're a good ninja, I guess no one gets to see you. And I think being the pirate, there's so much more fun to be had with that.
That's true, although I'm totally Team Ninja. Did you guys ever play that game as, like, a kid where you're, like, ninja and then you had – if I was a ninja, like, I'd be so good at that game. I'd get such props. Gosh, I don't quite understand this. It looks like Sandy will be joining us again. While we wait, I'm going to go through our live stream announcements. So first, this live stream is educational and is not intended to replace therapy. For treatment-related questions, please work with your provider or contact a local clinician. You can use the IOCDF's online resource directory at iocdf.org/find-help to locate a trained clinician near you. The International OCD Foundation is not a crisis hotline. If you're in crisis or ever feeling suicidal or unsafe, please call the 988 Suicide and Crisis Lifeline by dialing 988. You can also access this online at www.988lifeline.org. Go to your local emergency room or call 911. And we want to create a safe space, be kind and respectful to everyone. At the end of the day, we're all here to support one another. A note, too, that this is being broadcast on several social media platforms and is being recorded, which always is a little stressful thing to hear. But we're excited to be here today. So with that, I think we may as well go ahead and get started and do some introductions. So to introduce myself, my name is Jessie. I'm one of the leads of the Chronic Illness and OCD Special Interest Group, and I have had OCD my whole life and started getting chronically ill about 4 years ago. Went through a very long diagnostic process, took a long time to find what my diagnosis was, and recently found out I have a rare disease as long as some additional chronic illnesses that like to join the mix. So this is something I'm really passionate about and have met some amazing people who are also passionate about this as well. Sandy, let's hear. Can you hear us? Sandy? Dang it, I thought that would work. Okay, I'm going to go to Mary if you can introduce yourself.
Hi, everyone. So my name is Mary. I am also one of your chronic illness and disability SIG leaders. I was first diagnosed with OCD actually relatively recently. I didn't get my diagnosis until I was in grad school, but I had symptoms beginning when I was a young kid. They thought I was just highly anxious and perfectionistic. Turns out it was a little bit more than that. I also have a smattering of chronic illnesses. If you ever come to our SIG, you'll hear me refer to it as an alphabet soup. Because I seem to collect acronyms like they're Pokemon cards. But I'm very happy to be here, and this topic is near and dear to my heart. So thank you all so much for having me tonight.
Thanks, Mary. Let's go ahead with Jake.
All right, thank you so much. I'm Jake. I'm also one of the leads for the SIG. I'm a licensed professional counselor, and I also have lived experience with OCD since age 12, and also living with multiple sclerosis since college. And yeah, just really excited to be here and get to talk about this topic. I think there's just a lot of different things that we'll cover tonight that hopefully can be helpful or illuminating for everyone. And I'm looking forward to the conversation.
Yeah, same here. Thanks, Jake. Megan.
Hi, I'm Megan, and I'm a licensed clinical professional counselor based in Maryland. And I participate in the SIG meetings and love hanging out with this wonderful group of people. I also got my OCD diagnosis officially pretty recently, just in 2022, but I now know that I really experienced my first significant episode when I was about 14 years old. I started having a lot of symptoms, unexplained symptoms of chronic pelvic pain and pelvic floor and GI issues when I was in my early 20s. And it took me about 15 years to finally get an endometriosis diagnosis. And there's still some things that are unexplained, but I am grateful to have both the OCD diagnosis and the endo diagnosis. It has been really helpful to know more about what's going on.
Yeah, and one of the things we'll talk about probably later on is that like long period of uncertainty, right? Where like if it's not immediately clear what it is, it can take a really long time for the medical system to kind of tease out, and you get, to use Mary's terminology, ping-ponged from doctor to doctor to doctor to try to figure out what that is. But before we go into that, I kind of wanted to start out with like, why this topic, like interacting with the medical system? Like what might people with OCD struggle with when it comes to interacting with the medical system? Oh, Meryl and Katie and Beth, everyone's in the house tonight. This is awesome. Mary, if you could answer that with people with OCD and interacting with the medical system.
Yeah, I think that there are a lot of interconnections in what makes the ability to go to the doctor difficult, the ability to feel heard by your doctor feel difficult, the ability to feel heard by your therapist feel difficult. I know that sometimes there is the experience that I've also had personally, that when you go to the doctor and they see OCD on your chart, they're going to assume, just by that bias and think, oh, maybe this person is compulsing here. Or maybe they are engaging in some health anxiety or illness anxiety behaviors, and they're Googling symptoms, or they're over-reporting their symptoms. And that's actually, I think, not the case. A lot of people with OCD, I've learned, struggle to actually get to the doctor and feel heard. And one of the reasons why I was so happy to join this live stream tonight is to talk about that and how to properly advocate for yourself when you go to the doctor, to talk about, your symptoms and what you're experiencing outside of your experience with OCD. So those physical aspects too.
Thanks, Mary. Jake, anything you would add to that?
I think the only thing I would add, Mary said it well, of, a lot of people with health anxiety, OCD, there's also it can be underreporting of symptoms, right? Like there's this concern for, well, I don't want to come across as this just being anxiety, so I'm going to wait, or I'm going to, wait until the symptom gets to a specific stage, and then I can actually report it and feel like I'm being understood. So it's kind of a double-edged sword in that way. Like it's the fear of not being heard and not being understood, but also the underreporting and then waiting and then not getting the answers that you need or getting the help that you need.
Definitely. And I'll just jump in here too by saying, like, I know for me, my OCD, like when you think of relationship OCD, I feel like that's typically thought of as like a boyfriend or girlfriend, significant other, whoever that may be. And for me, I have significant relationship OCD with my doctors, where I want to be seen as like the perfect patient. Like I'm doing all the right things and I'm following their orders, which is kind of funny because I feel like usually I don't because I'm afraid to take the meds. But I like am very concerned about how I appear to the doctor, especially because, as you were saying, Mary, like with OCD in my chart, I feel like I'm almost concerned and overcorrecting for that. I saw you shaking your head, Megan. Anything you would add to that?
Well, I just love you comparing the relationship with a doctor to, I mean, it is a relationship, and there can be ways that OCD shows up in the midst of that relationship. I think of when I first told a medical provider that I had OCD. It was like my fresh diagnosis, and I was filling out some new medical forms, a new provider, just a new primary care doctor. And I was like, I will own it. I'm going to own it. I don't need to be ashamed of this. Like, I am learning to understand this, and I'm going to put it here. And I was really grateful that my provider like saw that on my chart, and she just, had a like really quick check-in, and she's like, oh, OCD, that can be really hard. And I was like, yes. And then there was that moment of like, what now? What do I share? And that was what I was thinking of with the initial question, is like just knowing what it is to share and when, which is a question no matter what diagnosis a person has, what is relevant to this appointment with this provider. But the ways that OCD can make us doubt ourselves and, doubt intentions, or, doubt how someone is treating us, or what, it just makes it all the, I think, more challenging to figure out what that filter needs to be so that the appointment is the best that it can be.
Yeah, definitely. Sandy, third time's the charm. Should we see if you're able to hear us? Can you hear us? All right, maybe third time isn't the charm. But at 7-11, KP said, yeah, I'm known to underreport, but getting better at advocating. And I think that's something we talk about all the time in our SIG, is that you really have to advocate for yourself sometimes. Like I tell this story in the SIG as well, but my mom was the one who found my rare disease through Facebook, of all places, but then advocated to my doctor and was like, give Jessie this test. Like, she needs to have this exam to see if this is what she has. And I'm so grateful for that. But with OCD myself, like, I would have been scared to do that. So it can be really helpful to have people who are more comfortable advocating and to become more comfortable advocating yourself. Going off of that, like, there are things that can help. Like, there are useful resources, there are tips. What would you all recommend, like, when people are interacting with the medical system and it might be really challenging for them? Like, what are some tips or resources that they could use? I will go to Jake for this.
I think, as one of our commenters said, like the self-advocacy piece, I think, is just vital, like with all of this, and being able to kind of prepare yourself for that appointment of, I need to go in and know what you want to ask for. And at the same time, having some self-compassion around that of, especially if it's a new provider. If it's a provider that you already know and are comfortable with, that's one thing. But if it's a brand new provider, being able to sit with that and recognize, okay, this is like basically starting a new relationship. I'm going to ask for what I need, but I also recognize I have to kind of figure out this whole dynamic that I'm going to have with this new provider.
Mary, I know you have a fun term. What would you say?
Before I introduce my fun term, I actually want to bring up three pretty vital things that I always recommend, my own clients bring when they go to the doctors. The first thing, right, is if you go to the doctor and you find that advocating for yourself is difficult, or you find that maybe you aren't going to be taken seriously, or if you're like me, and have suffered a traumatic brain injury, you're going to go and you're going to forget. So one thing that I always recommend everyone to bring, whether it's on a sticky note or through your handy dandy smartphone, is bring a bulleted list of what you aim to talk to your doctor about in that appointment. Most of us, we see our doctors for only like 15, maybe 30 minutes in these appointments. Sometimes it's really easy to only bring up one small thing or get stuck on like a segue topic. Bring a bulleted list and say, hey, I have a plan for us today. So that bulleted list is the first thing. The second thing is, as you're talking about the items on that bulleted list, it might also be helpful for you to, prior to this appointment, keep a symptom log. So if all right, I know I have OCD and here's how my OCD manifests, but I also know that I have this maybe aching pain, or maybe, I have developed this rash that's been here. When did it start? How bad does it hurt out of 10? How much does it take away from your day? So keep a symptom log that you can refer back to, right? So bulleted list, symptom log, and then the final thing is, if you're able to and you feel comfortable, bring an advocate. I bring my mom. I'm willing to bring my partner or a friend, someone who can sit in the room with you and vouch for your experience. I've had a lot of experiences with doctors not taking me seriously because I look healthy, or because I'm young, or because I am a woman. I must be hysterical and exaggerating things. And I've had doctors miss things throughout my life that I could have gotten treatment for much earlier. It could have really improved the quality of my life. So advocate, symptom log, bulleted list of here's what I want to talk about today. And I don't want to take up too much time. So do you still want me to talk about my handy dandy kit?
Yeah, because I think it's brilliant.
Okay. So in my therapy office, I do enjoy a little bit of wilder language, but for the sake of this live stream, I call it my kit. And it's when we're out and about and we might have a physical flare-up of something. Keep on deck in your car or your carry-on bag, something that can help you in those moments. So if I experience a lot of chronic pain, you might be taking some Advil with you. I get nauseous a lot. I get sick a lot. You might take some baggies with you. You might take, like your mints or a Zofran with you. Everybody's kit looks different, but having a collection of items that will help you through a physical moment, again, not items we use to compulse, right? So none of these are OCD safety items. These are all, if I'm struggling in a moment, what am I really going to need to physically get me through this? That's what you can put in this little baggie.
It's so brilliant. I want to highlight too what KP said at 7:15, which goes along right with what you were saying. Get your insurance to provide a patient advocate so you can fight insurance and know what questions to ask. Sweet. So you're less likely to get ping-ponged around and likely to get care quickly. I know too, if Sandy were on here, which hopefully that'll work out, but she's talked a lot about like bringing her mom to appointments, which I do as well if I can. And I feel a little intimidated now because I know my mom commented. So now I'm a little more intimidated saying this, but it's really helpful because I'll sometimes walk out of an appointment and be like, dang, like that sucks. And my mom's like, are you kidding? Like we got that new med or we got this great advice. And I'm like, yeah, wait, you're right. Because my OCD will have this like negative bias or I'll start catastrophizing. Whereas like having that other person there can be just so helpful. Megan, anything you would want to add on this topic?
Oh man, I feel like Jake and Mary really covered it well. But I'll just add one quick thing, which is to be gentle with oneself, like to be gentle with yourself before and after, and find ways to build in, whether that's rest or like a treat or something. Like I used to not do this, and I would like run from work to an appointment, and they, I don't know how many times the doctor's not been able to get an accurate blood pressure reading on me because I have just been like rushing, and they're like, what's going on? And I'm like, it's life. And it was traffic. And so now I try to just build in some extra time, not just because of having my blood pressure taken, but because I want to be able to show up to the doctor's appointment, particularly some of those like really important ones I've waited a long time for. I want to show up as like grounded and level-headed as I can be. And then afterwards, I try to build in something that I enjoy. Not every doctor's appointment is hard, but some of them are hard. And I have left doctors' offices and just been in my car and cried. And I give myself space to do that. But then I also do things that like are just feel good. Like there's a bakery that I like to go to, and my doctor's appointments usually take me up toward that bakery, and like I'm going there. Like I'm getting a latte and I'm getting like a cardamom roll, and like I have that to look forward to no matter how this appointment goes.
I am totally implementing that, and I love everything about it. That is awesome. Kind of going off of that, like, or I guess this doesn't really go off of that, but I'm curious, like a lot of us in the SIG, and a lot of people who may be watching, like have a chronic condition where they have to go to the doctor a lot. Like we're used to like this being a part of our like weekly, routine. What like advice or hope might you give to people who, it's hard to experience OCD and then to throw this other thing on top of it? Like what advice or like what hope would you give for that? And Megan, I'll start with you.
Oh yeah, I love this question, because for a long time I didn't think there was hope. I really was just like, there is no answer in the medical community. Like I have to just manage on my own with the support of, friends and family, like when I can get it. But I was like, I really felt like acceptance, like, embracing a spirit of acceptance in my life was accepting that the medical community could not offer solutions. But I think the way that I kept hope alive, that one little piece of hope that there might be a solution, was that I would continue to share my story with people with the sense that like, you know what? I live in a big metropolitan area, and like new people, new medical providers come in and out, like friends, hear about new doctors or, someone I've just never heard of. Treatments continue to evolve. And I was like, maybe at this moment there is nothing. I don't know what to pursue, but maybe in the future there will be. And it was actually through the sharing of my story with a friend, like some of the things I was struggling with, that she connected me with a physical therapist. And I thought, well, this isn't even going to fix it, but maybe it'll provide a little bit of relief. And she was the one who saw me in the midst of a flare up and said, I think you need to go to this doctor. And it was like years and years in the making. But I think that's it. Now having been through that experience, I'm like, there can be these surprises along the way. And sometimes it's just the way we keep hope alive is we just continue to share and we see what happens. And the waiting can be hard, but it doesn't mean that there won't be that little shift or that opening.
I feel like we could tell that Megan is an OCD therapist when she said like, maybe there will be hope in the future. Like that's such a good point. And that's like what ERP teaches us, right? Like an act and like that, there might be hope. And I love that you said that. I also want to highlight what Mike Sizemore said at 720. You may feel ashamed, afraid, or incapable of advocating for yourself, but you have to. And I love that. And even just like going to the doctor, I know a little further down, Cash said, I avoid doctors. And even Beth said, I avoid everyone, which is very funny. But like, it's true. Like, even just going to the doctor is advocating for yourself, even if it might not seem like you're the typical form of advocacy. That's totally advocating for yourself. Mary, I'll go to you. Same question about hope or advice for people who have additional chronic symptoms.
You know, at the end of the day, I think just honing in that frustration, honing in that anger that comes with having to wake up and go through this rigmarole all over again, and using that to motivate you, using that to remind yourself that you're worth getting better, you're worth receiving help. Even on the days where like, I don't like, there is no cure, like, I'm not going to see it in my lifetime. You going may still help someone else, right? I'm very loud about one of my chronic illnesses, which is I have a dual neurogenic bladder and interstitial cystitis. And it was actually like you, Jesse, who I was being vocal to, where I was like, oh yeah, here are some treatments. Here are some options for this. And I know that like, at least at like my particular clinic, I was the only one in my age group that they had ever seen with interstitial cystitis. You know, they flat out said to me, oh, that's an old person's disease. Like our average patient who has that is 85. And at the time I was 20. And just knowing like, okay, well, I might have been the metaphorical guinea pig here, but now the next 20-year-old who walks through the door is going to have an easier diagnostic process. Oh, there's my dog.
And I feel like you see this too in the OCD community a lot, even in this chat, like seeing people advocating for themselves and talking about different resources and sharing their story, I think is really powerful. And again, like that's how I found my diagnosis, was my mom searching through Facebook and different people advocating for themselves on different Facebook groups. So it can go a really long way, even if you may not expect it to initially go. It scared me too, Cash. The dog, it's okay. We'll go to Jake. Mary, don't worry.
I think the only thing I would add is because Megan and Mary both said, I think, what needed to be said, but like the acceptance piece, like also accepting like the grief and loss process, like, because I mean, there is a grief and loss process that happens with any sort of diagnosis. And once you get the diagnosis, going through the entire process of trying to figure out, okay, well, you know, I have these treatment options available to me. The treatment options, are they going to quote unquote cure me? Maybe not. Like it may be just something where it helps me manage, and that's also okay. Where, you know, finding the right treatments to be able to manage and building some more acceptance around that piece too, of there's going to be a complicated process around just accepting the diagnosis, and that's okay.
Yeah, that's for sure. Another thing that KP said, things get better. It may just be hanging out with friends, but looking for answers, even though it's frustrating, and share so others can have an easier time and help others feel hope. And Cash added, talking in safe environments is so important. And I think that's so true. Just feeling like you have the space to share is crucial. I will plug our special interest group, because it is the space where people are able to share. Rachel, if it's possible to add the link, that would be awesome. But, you know, there are places, and I feel like there, whatever it may be, whether it be a medical condition or, you know, something completely different, there are so many groups online. The more niche my rare diseases get, the more amazed I am at how many groups exist online. Like, you wouldn't believe, like, Facebook is a gold mine, maybe not for like it's a gold mine for compulsing too. But using Facebook and these resources accurately can be truly incredible. I know Beth wrote here at 7:29, maybe if you have health anxiety, the doctors may just dismiss your symptoms, thinking you're bringing it on yourself. Symptoms aren't real. You're just thinking something is wrong, which goes right into what I wanted to segue into, which is talking about health anxiety. A lot of us, I have health anxiety and a chronic condition and OCD. So what do you do if you don't want to overreact, but you also don't want to underreport? So it's a fine line, right? I'll go to you, Jake. Like, what do you do in that circumstance when you have health anxiety and OCD, or health anxiety and like a medical condition?
I'm going to use one of my favorite phrases of both and. I think it's important to come at it from a perspective of, I mean, even if you have diagnosed health anxiety and you have a diagnosed medical illness, they do play on each other. And it's not necessarily that you're, making up your symptoms. It's not that you're over reporting your symptoms, but just the stress from the anxiety itself could be exacerbating other medical symptoms. And so being aware that, there is that interplay, and having a frank conversation with your medical provider of, yes, I have medical, my health anxiety, and I have this diagnosed condition. It's playing off of each other. I can see it. I want us to work together on trying to figure out the best path forward, because I still need treatment, right? Like if it's something that I'm having a physical symptom of, the doctor can be compassionate and understanding and say, well, why don't we try this? Or why don't we go back to one of your other, even if it's just a coping skill, right? But not just dismissing out of hand.
Definitely. Megan, anything you'd add on to that?
Yeah, I think that for me, it's been helpful to notice the sense of urgency, like if there's a sense of urgency present. And sometimes something does need to urgently be addressed, and I don't know all the different things that people deal with, but like if you've dealt with something for a while, like what a significant change in your own situation is. Or if I, suddenly like, oh my goodness, I'm bleeding, and like I see something and I need to monitor, and there's like a visible change. But sometimes there's just like that feeling of like, I have a sensation in my body. Oh my gosh. And now I need to I have to go act on this right now. And when I start to notice those two things together, or like one, the urgency immediately following what I notice in my body, then for me, it's become a signal to slow down a little bit, to maybe give a little bit of time and space, because that's a really different experience. That for me is like what OCD feels like, or that anxiety coming on, versus a like, dang, here's that feeling again in my body. Like it's been 5 days of this, like, and it's different. I don't understand. Like that has from inside of me a different quality, a different energy. Even if the feeling might be the same in both, there's like the different sense of like, how quickly do I need this addressed? And I'm certainly not saying that if there's something going on and you're like, like slow down when there is a real issue. Like some things require the emergency room. But for myself, I have learned to discern, like, here's a set of things that are like, oh, that's OCD drawing me to the doctor, versus, oh, this is my symptom and I really need some help with this right now.
I have found it helpful, like you were saying, Megan, like if it's not, like if I could tell, like this isn't like a life-threatening, like ER, like needing visit, to kind of try to wait it out, like see if I can like wait to go to the doctor or to call my physician. Because you're right, like a lot of OCD is that urgency of like, I need to figure it out now. I found this a lot. I know people are mentioning COVID, but with like getting COVID tested, like I need to know all the time, like if I have COVID or not, and kind of like carefully and like healthfully, like waiting and like seeing like, no, I could go a day without being tested, was very helpful. Mary.
Absolutely. I think everything that the other guest speakers have said tonight has been so important. And one thing that, I tell my own patients is get that medical rule out. Get that medical rule out. Even if it is psychosomatic, at the end of the day, you still deserve relief from your symptoms. You deserve shame-free relief from your symptoms. Whether, that tense ache in your body is from something developing or is a reaction to anxiety or stress, you still deserve help. So getting that medical rule out, especially like if you're working with a therapist and saying like, hey, I do work with my therapist. I do a lot of advocacy on the behalf of my patients. I encourage other providers to do that. If they have the time, get that ROI, have that collaborative care, that communication, because it's only going to help yourself at the end of the day to get that rule out. And you're only going to help your patients at the end of the day if you help them seek the appropriate steps in their care.
Yeah, and I'll add on to that too. Like for me, it can be really hard to like know like, is this health anxiety or like, is this one of my conditions? And my therapist has talked to my doctors many times of like, she's even been like, is this health anxiety? Is this one of the conditions? Because it can be really confusing and they could like enmesh a lot. I will say too, there's a good book by Josh Spitalnik and Michael Steer, I believe, who just like wrote a book about health anxiety that's really good and gives a lot of information. But I think it all gets a lot more complicated when you also have this other condition that like can sometimes be, not too clear. Like you don't know what it is. I know someone in the, like we had talked about before, like people saying like avoiding doctors. And that is certainly real. What would you say to someone if their like loved one or they themselves are avoiding doctors? Mary.
Me right now avoiding my own doctor's appointments. Have a loved one with you to help you make that call. Sign up someone that you love as your proxy, preferably someone who is a little bit tenacious and annoying, so that they'll nag you to do it. My mom's not watching this live stream, but eventually when I send it to her, hi mom, because that's the person that helps me. And even seeing if you can go the route of a telehealth appointment first, so that you can cut out all of those boundaries to care that would be taking the time off work, getting in the car on other public transport, waiting in the office. We can make it kind of an ERP. Right? Telehealth is a great place to start, even if it's just a phone call. A lot of clinics have different options of care now. They might eventually want to see you in person, but I think especially like that initial, like, okay, I see you face to face and can hang up and immediately decompress is a really helpful first step.
I love that idea. Jake?
I would just add, especially when trying to move forward with getting a friend or a family member to go to the doctor, is to try to understand a little bit of like, well, why? What is it about going to the doctor's appointment that's so anxiety provoking? Because there may be some tangible, concrete things that you can make differences in. If it's a problem of just going by themselves, you go with them. If it's a problem of communication or the doctor has been dismissive in the past, all right, let's like create a strategy or a plan on how to address this at the next appointment, or to advocate for a different provider. Some of those things, sometimes it's very easy to get stuck in that mentality of, okay, well, they don't want to go to the doctor, we just have to rip that Band-Aid off. Sorry, that's a little bit of a pun. But being able to say, okay, well, but like there's usually a reason. I mean, anxiety doesn't need a lot of reasons, but there's usually a reason behind why am I not going. Having a little more understanding around that, trying to address some of the concrete things you can change, and then moving forward with that. Okay, you know what? I'm going to help you I'm going to call you every day or text you every day and say, hey, have you gotten that appointment set yet? Do you need someone to go with you? All of those things are awesome.
So everyone needs an advocate and an annoying person to
Yes.
the takeaway. Any other characters we should include on our cast, Megan?
I think the barista to make that latte that I get for myself after
and
my
the cardamom muffin that I don't even know what that is, but I want to
exactly. Yeah. Oh my gosh, I love what Jake and Mary said. Like, and it got me thinking of things in my own life that have made a big difference with feeling a little more willing to go to the doctor. Like I moved cities, and for a while I was really set on like keeping my doctors where I was. And then in time I was like, I actually hate this. Like, I really hate this drive to these doctors. Like, this is becoming a barrier that I am keeping in place for myself. And I think I ended up keeping one doctor. I was able to like whittle it down and say, this one doctor, it's important to make the drive for these reasons. These other doctors, I don't need to. Is it parking? Sometimes it's parking, or it's time of day. Like when they offer me those early morning appointments, in theory, I'm like, oh, maybe that'll make me a morning person. It doesn't. It just makes me not want to go to the doctor. And I'm tired and grumpy when I'm there. So yeah, all of these things matter. Lower the barriers, and then you can do that work of going with the help of the barista and the advocate and the angry person.
I love it. Kind of similar. I actually just thought of this question. I'm very curious to hear what you guys have to say. I know I've personally experienced where like I'm not avoiding going to the doctor, but I'm avoiding telling my therapist about some like when situations are more like uncomfortable or more taboo. Like I have a lot of GI symptoms, or like endometriosis or stuff that's a little more like sensitive to talk about. And I know like that can be really hard to broach with a therapist, and it's hard to broach with the doctor too. Like, what would you tell your clients in that situation? I don't know who to go to first. We'll go with Jake.
I would say we want to hear it. I mean, all of us got into this field to be able to understand people better and to try to help through these difficult situations. And so we want to hear about it. I mean, it's uncomfortable to talk about, all the taboo topics, anything like sexual health related, anything GI related, urinary related, but being able to talk about it with your therapist is one of the safest spaces that you're going to get. And they're going to be able to help you work through, how am I going to actually talk about this with my doctor? Or how am I going to bring up, that I need to have either an exam or I need to have a procedure done. Talking about it is the first step. And I think I don't know, that's why I got into counseling. I wanted to be able to help people work through that.
I feel like I'd open up to Jake right now. I'm like ready. Mary, what would you say?
Everyone is human. I think it makes sense when people come in and they're very shy to talk about their body parts or their body processes. A lot of us are raised and socialized that you don't talk about it. But we all have body parts, and we all, last I checked, are human beings, so which means that our bodies functions as bodies do, which is just like a really professional way of me saying everybody poops. So if you go in, and whether you have to talk to your therapist or your doctor, I think reminding yourself that they are human and their role is to help you, especially if they're an OCD therapist. We eat, sleep, and breathe this. Like, OCD therapists will get together to be like, how can I make the most realistic type of excrement? Right? How can I make this as real as possible? We have no shame. You're talking to the people who have no shame, right? And your doctors who went through medical school also have no shame. They lost that shame in the process too, right? So being your own advocate, you know, writing down your symptoms, having that bulleted list to refer back to, that even if like you're like, oh, I can't say this out loud, but I can turn my phone screen. I can, you know, take down another barrier to that treatment and be like, I can't say this out loud. Here you go. Right? Gives them a better picture.
I love that so much. Now I know why medical school is so long. It makes sense now. Megan, anything you would add to that?
Just that it's okay to slow down. I mean, everything that Jake and Mary said, yes to that. We are human. Like, and as a therapist, I also want to be able to accompany people through like what is actually going on. And also it's okay to slow down. Like, you don't have to, I'm going to use what Jake said, you don't have to rip the Band-Aid off. Like, you can start to have the conversation, or even acknowledge for your therapist, say in therapy or with a provider, like, I am wanting to talk about something and I'm finding it hard. And there can even be like that prep work, you know, and then maybe you get a little bit closer. Like, I am having these sensations, and then maybe you get a little bit closer. And there's no one particular pace at which it has to go.
Yeah, and I think Mary, you'd mentioned this before, like almost thinking about it as an exposure. I feel like I get like more motivated when I think of something as like an exposure of like, yeah, like I guess I also feel more productive. Like, look at me doing my ERP. But then you're able to kind of frame it in a different way that like makes you able to like be motivated to go through it. I love seeing all the comments. Please feel free to ask any questions you have. I feel like I'm selfishly getting a lot of my questions answered. So please feel free to ask any questions. I am curious, like in talking about like exposure and ERP, what would you say, like what would ERP look like for medical appointments? Like, I think it's really cool that like ERP is so helpful for OCD. I've also found it really helpful for my chronic illness. So, Jake, what would you say like that would look like if you're like doing exposure when it comes to medical stuff?
I think like what we were just talking about is a really great example of, okay, like talking about these topics. It's really hard to say the words. Okay, I have to go in for a sexual health concern, or I have to go in for, something that's going on with, reproductive tract, those kinds of things. Being able to frame it as an exposure of saying, you know what, I recognize I'm not going to be able to say these words. I'm going to go in with it written down, like Mary said, and I'm just going to show like the piece of paper, or I'm going to show the phone first. That's the first step. And then I'm going to sit with that. I'm not going to, try to do any mental compulsions around it. I'm not going to, I'm just going to sit with that I gave the information and sit with that discomfort. And then work your way up. I mean, I think the concept of the hierarchy is so useful in so many different situations of, okay, well, I'm just going to take the first step. I don't have to get all the way to the end step of, I'm going to give every excruciating detail of, my bowel habits and going to the bathroom. I don't have to do that the first appointment. This can be a step-by-step process. And you also pick up from your medical provider, okay, where are they at with their comfort level with this? If they just start talking about it, it might be time to move up on that next stage of the hierarchy and push yourself a little bit.
Yeah, and just to highlight Lee, hi Lee, Lee's amazing. At 7:48 said, can confirm medical doctor with lived experience here. Nothing better for breaking down barriers than knowing we're all the same. So thank you for commenting that, Lee. I think it's so true, and so helpful to hear your expertise there. Mary, I'll go to you.
Yeah, in terms of ERP, we're often faced with, if I continue to do the same thing, I know I'm going to get the same result, right? What if this new result is bad? What if it's really good? Right? And what I remind myself and others with chronic illness and OCD as a combination at the end of the day is the only person that suffers on account of you not getting the help that you need, on account of you not getting the help that you deserve, is you. So if you make the same choice that you made yesterday or earlier today about not having that conversation or not taking that step, that's one more day that you're going to hurt. That's one more day that you are going to struggle. And it might be that what you're dealing with is chronic. It might be that we have to move to the stage of acceptance of living a life with something, anywhere from mildly to severely uncomfortable. And that's, as Jake said earlier, a grief process in itself. But by taking a step just outside our comfort zone, right? By expanding that window just a little bit, we get more of our life back. Even if it's just being able to go with that flow, it's no longer as exhausting.
I feel a little called out, but I love it, Mary. Megan.
I think medical forms, even in themselves, can be a really good exposure, like filling out medical forms. And it relates a little bit to what Jake was saying around like writing things out. If you're not ready to say something, you can write it out. But every time I fill out a medical form, I feel like it is a form of exposure to what is my own worries about like what a diagnosis could be, to even like thinking, what are people going to think about this, seeing this on the form? So I think there are so many opportunities in engaging with the medical community to practice not white knuckling it. To really like I could scribble on the form, I can like here you go, like person at the front desk, take this, or, click. But if I'm noticing that like that is bringing on some of that anxiety for me, like actually even that, and I'll acknowledge filling a form is annoying. Like that in itself is like not fun. But like that moment could actually be a moment of confronting something and taking that time. Or being in the doctor's office itself. Like I have struggled sometimes because of these difficulty with blood pressure readings. Like I was like, I can't look at it. I can't look at the number. I can't notice. And it's like, no, actually, I think maybe that could be a good thing for me sometimes to, did I pause? Oh, no, sorry. It looked like it had frozen. But to like use that environment and use that space without even having to craft something additional. It's just like being in those spaces and kind of taking it all in. I also think that trust does build up over time. Like Jake said, you don't have to say everything all at once in the name of exposure. Like you can, especially if you're meeting with a new person, like trust needs to be earned. And it is natural to wonder if it's the first time, like, who is this person and how will they receive me and how will I be treated here? So, just take it at a speed that makes sense and work with your therapist to figure that out.
Yeah, that's great advice. I'm interested in hearing your responses. At 7:51, Beth Cardici said, "That's what I'm afraid of, developing a chronic illness by getting long COVID." And this is something that I've heard a lot recently, actually, since like people are better understanding long COVID and they're getting like very symptomatic from long COVID. I know a big fear is like developing a chronic illness. To that, I would personally have to say, like, it's really not the end of the world to get a chronic illness, as sucky as it is. Like, I feel like even going through OCD treatment has taught me so much about like acceptance and commitment. And yes, there is a grief process, but like look at these amazing people who are doing it every day and who live their lives. Like we all have very functioning lives with OCD and a chronic illness. So even though it can be very scary and it's something that I'm nervous about myself, knowing that like you will be okay is something that I find a lot of comfort in. Anyone else want to weigh in on that one? Oh, it's better when I just call on them. I'm gonna call. Okay, Jake.
I was just going to add, I mean, some of the things that can happen with long COVID are scary, right? I mean, it's just acknowledging that, one. But two, one of the things that I think comes up in ERP therapy a lot is the piece around, okay, is the worry and the amount of thinking and preparation that I'm doing actually in proportion to the risk? Right. And we could probably argue that all day long. Not that we're going to argue with the OCD, because that's not going to get us anywhere. But, am I suffering in a way by trying to prevent COVID that's just as much as suffering as if I were to catch it? If I had to stay home, if I wasn't able to breathe, in a functional way, or I had to be on, specific treatments. Okay. Yes, that's something that, you would have to cross that bridge when you get to it. But there's also all the pain and suffering that goes along with sitting with the OCD symptoms. And I think that's really important to recognize that, okay, it doesn't really outweigh it. Is this worth the risk of going out and living your life and trying not to do all of the preparation and the compulsions around preventing this versus, okay, I need to live my life and I need to do things that are important to me.
I love that answer. Megan, I see you're unmuted. Anything you would add?
Yeah, I think too that in the midst of that wondering or those worries, like there can be an image that comes up in one's mind of like, I could get this, I could get long COVID, or I could have this issue, and it will only look like this. And really, there's like so many ways, as you were saying, Jesse, like so many ways that like people live with chronic things. And like it's true that some things are, are like really hard, and there are days where a person feels like really stuck and really debilitated. Like I don't mean to overlook that reality, but when the scary story is being told in one's mind, like the fear of catching something or developing something, and then it's going to look like this, it actually paints a picture of us without resourcefulness, without support, without that innate creativity that each person has to do problem solving. And so I like to remember that too, that I go, yeah, okay, this thing could happen. And like, I don't even know exactly what that would look like. So as Jake said, maybe I can let that go for now and just trust that, like, if I come to that bridge, if I craft across that bridge, like I can assess at that time, like what can be done to live as best as I can.
I love that. I feel like there are so many diseases I'm afraid of getting that I literally know nothing about. Like I have the idea of like what it will look like and how it will destroy my life, but I don't even know what the symptoms are. So that's such a good point. Mary, is there anything you'd like to add?
Absolutely. And I heard my dog whining again in the background. So I'm just going to prepare.
You're giving us the warning now.
Right. We're all going to sit with this anticipatory anxiety. Okay. The one thing that I can think to add is that it's 7:59 p.m. on a Tuesday, right? It's right here, right now. We only have this moment. We don't have 5, 10, 20 years in the future. We don't have 6 months in the future where we could have, long COVID or any other chronic illness. We don't know what's going to happen tomorrow. We can kind of estimate what's going to happen 5 minutes from now, maybe if we have a routine, but we really don't know. So we're doing ourselves a huge disservice by stealing our own today, right? So if you notice, I'm just going to keep jumping to the future, walk yourself back. Right here, right now.
I don't know why I'm going to say this, but there's a, there's a amazing therapist named Tracy Ibrahim, who we all know, who's great. And she always says, like, what if you spent like you don't know if you're gonna this is so triggering, but she was like, you don't know if you're gonna drop dead in the next like day. And what if you spent that whole time compulsing? Like your last day, you just spent sitting there compulsing about the rest of your life that you never even got to have and you didn't enjoy the moment. So while it is very triggering, and I apologize if that triggered anyone else, like it really does make you think, like, I'm spending so much time being worried about this thing that I may not even have the chance to experience. So on that note of death, I'm totally kidding. Um, I I wanted to talk about what KP said at 7:55, talking about like how do you do the hard thing. This is something I personally really relate to, of starting treatment with a lot of medication side effects, and like no one wants to experience side effects from medications. I'm personally going through this because I tried a medication for nausea that like wiped me out and I actually fell asleep in class and it was very embarrassing. So I don't want that to happen again. Like I did have the negative experience, but like I don't want to have nausea, and there's that fear of like trying a new medication like could have this same thing. And again, this is going to be a selfish ask, but like how do you get over, like what do you do? Like do you just kind of like bite the bullet and like take the medication? Like how do you kind of work up to doing that when you have had an adverse experience? Mary, you're smiling, so I'm going to go with you. You're ready.
Well, I'm also partially smiling because the little terror is now under my desk. It's getting closer, everybody. I have had a bad experience with medication. The first ever medication I took for depression, which was secondary to my OCD symptoms. I'm not going to name because some people have had great outcomes with this medication, but I got tremors from it. It didn't help at all. It did not feel good to feel like a jitterbug all day. So what did I do? I stopped taking it. A lot of these medications that people are very fearful of for their OCD. And again, I'm not a medical doctor. This is talk to your doctor, not me. But well, what if I'm going to have, all of these side effects? If you do, you don't take your next dose. You let your doctor know immediately, right? It actually took me 3 different medications before I found the one that actually really worked for me. And I'm telling you, it's night and day. My symptoms, at least on the OCD front, are night and day. We're still figuring out the ones for the chronic illness or illnesses that I'm dealing with. But it was worth it to take that step outside of my comfort zone and recognize, all right, my symptoms are going to stay the same and in fact probably get worse if I don't get help.
That's a really good point.
Right? I could try it, and if it doesn't work, I now have data.
I feel slightly more convinced.
ever so slightly. If it does work, I now have a better prognosis on my life.
I love that. Megan, anything you would add?
Yeah, I like this question because it is, so many of these have been relevant to my own life, right? But like for me, there was a realization of like, I am just having to work so hard. Like I am having to work so hard to manage symptoms, like different kinds of symptoms. And I don't even know if, at any given day of what all the work that I'm doing will even help, because I felt like the rug could just be pulled out from underneath me at any time. And so it was this realization of like how hard I was working and wondering like what extra support could I get through medication to manage symptoms. Like that really helped me to take the step. And then something that helped me to like deal with that fear was what I said with the last question around like, like if I do notice changes in my body, like things that are like symptoms that are not resolving, like I am resourceful, like, and I do have providers that I trust. And like, I know that this is not a dead end. And I'm really grateful that when I have needed to change medications, the people that I work with, my doctors, have been responsive. I know that's not always the case for everyone, but if you have that like a trusting relationship, and they've been responsive for other things, there's a really good chance they're also going to be that same supportive provider if you are struggling to find the right medication. And also, you may not struggle. You might just try something and it really could be great.
I really like that. And this is like related, but on a little bit of a different note. I don't know if anyone's heard of like the trust jar that I believe it's Brene Brown. My therapist was telling me about it, where it's like like I should know better before trying to explain it. But like if someone's like shows you trust, like that trust keeps building and building as if it's like in a jar of like yeah, I like can trust this person. And I feel like I go into each new appointment so skeptical that it's true. Like we can learn on people's prior patterns, that like no, they've been there for us, and like also this is their job. So yeah, I really like that you said that. What about you, Jay?
I'm trying to think if there's anything that hasn't already been covered, because
No, that's okay. We have covered a lot.
I think I was just going to say, you know, for like the fear can come from different places, right? Like the fear of the side effects. Part of it can be the fear of the unknown. Some of it can just be fear of, I don't want to feel that side effect, or I don't want to have that body sensation of, you know, whatever the side effect may be. And so, you know, on one side, I think working through that and recognizing there's also a thing called anxiety sensitivity, right? Like some people are just more sensitive to psychosomatic symptoms and somatic symptoms in general, right? Like if I get lightheaded because of my blood pressure, I may be more susceptible to that and panic more than, you know, another person would. And so recognizing that. The other piece is if there's any perfectionism involved with like, I need to find like the right medication and it needs to work the first time that I try it. Like recognizing that there isn't really a grading card, like you don't get a grade for like the appointment. If the medication doesn't work, it doesn't work. Also, most medical providers, if they're worth their salt, like they want to know if you're scared of taking the medication. I've seen it on the other side, working in both ERs and in integrated health settings, where like the doctor will come back for an appointment and, you know, put his head in his hands, like, they didn't tell me for like 3 months that they weren't taking the medication. And like they're flabbergasted because they're like, we could have been working on like 20 other options in that meantime. But if they don't know, they don't know, and they can't work with you on it. But I think that also goes with the trust piece. If you don't trust your provider, and if you don't feel like you can share that with your provider, you need to find someone that you can. And yeah, I guess that's all I have to say about that.
No, I love that. And when you said the whole perfectionism, Megan and I both like smiled, and I think we were both like, oh yeah. That's something that I didn't even realize was like part of it, but that's totally part of it for me. I feel like Megan's realizing the same thing in real time. Kind of related to what you were saying, like we're talking a lot about like if you trust your provider and like this like good relationship with a provider. What if you just like your doctor's really dismissive, or like it wasn't a good experience? Like what would you do with that? I'll go to you, Mary.
Yeah, you know, I think there are definitely a couple different avenues that you can take. I think if you have a good relationship with your doctor, let them know. You know, let them know. Well, let them know via email. Give them a phone call. You know, if it was a doctor that you're like, I don't know if it's worth seeing this doctor again, but I like the practice, the next time you make an appointment, schedule with someone else. You know, the good thing is like if you have insurance, most insurances have like a forum when you go on their website where you can look at the PCPs in your area or the specialists in your area that are accepting new patients. So if it really doesn't work out, there is always the avenue of you to find someone else. But I think if you like working with them, it's good to give them another shot. And at the end of the day, that's only going to build the rapport. That's only going to make things even better.
100%. Megan.
Yeah, you don't have to stick with a doctor who is continually making you feel unheard and who's just not getting it. But like Mary said, we all have bad days or days where we're a little bit more distracted. And I hope that, if you need to bring up a concern with a doctor, that every time they're going to be there for you. But sometimes there's just a day where there's a miss. And if overall your experience with that provider has been good, give them another chance. And if overall it hasn't been good, but there's still a part of you that's like, should I sever this doctor-patient relationship? I'd really take a look at the why. So I do remember there's a doctor that I kept, I stayed in their practice as a patient because I was going to them for a very specific reason. And I really did not like the interactions with this doctor, but there was a really specific reason I was going, and I was able to hold both of those realities. I do not like these interactions. And if I'm able to find somebody else with this specialty where they have a better bedside manner, I will go to them. But until then, this doctor is serving this purpose in my life. And so maybe I just need 2 cardamom buns after these appointments. But
now we're going to 2. It's getting more.
It's getting more. No, but really just being I can hold the fact that I don't like this, and it is this doctor is helping me. But ideally, we have the both together. They are actually helping me, and I feel heard and supported, and this is good. And I think too, dealing with side effects of medication is it is a common experience for, it just, even if the side effects are minimal. So if a doctor is really struggling to support you in that, that is a valid reason to look for someone else.
Anything else you would add to that, Jake?
What popped into my mind with that is, sometimes different providers just have different bedside manners. And even though we shouldn't have to do this, sometimes we have to adjust to that a little bit. One of my favorite neurologists, who unfortunately just retired this fall, so now I have to get a new one. But I've had him for 9 years, and it's kind of like a business meeting when we go into an appointment. It's not touchy-feely. It's not, warm and how are you doing? Tell me how things are going. We spend the first half of the appointment going over symptoms and the exam. We do the second half of the appointment going over research into the new treatments for MS, because he's a research fellow and he just knows everything. So he kind of rattles off all the new research. And then we set up a plan. It's very regimented how the appointment goes. And at first I was like, well, I kind of want a doctor that actually is going to have care about, how I'm feeling about all of this. And then I realized that's kind of his way of caring, is we need to get through and do the thing and check the box. And okay, well, I'm just going to show up to all my appointments to check the box and be prepared for that and have those bullet lists, have those symptom logs. And then we just kind of have a business conversation of hey, my body's doing this. What can you do to help? Or what options do you have? And he ended up being one of my favorites. And so I think that's just, it's important to recognize the relationships are going to be different. And even though we shouldn't have to adapt to all those relationships, sometimes it's helpful.
Absolutely. And just being cognizant as we're closing in on time, I think something that is really important to discuss that's very much an overarching theme of both OCD, chronic illness, disability, is loneliness. I feel like that's something that we talk a lot about in our group. And I don't know, I feel like I talk a lot about of it can be really lonely, and not just in the sense of like, oh, I'm like alone, but more so like you may not know a lot of other people in your daily life who have OCD. You may not know a lot of people in your daily life who have a chronic illness or who are also struggling with health anxiety. And it can be very hard to like feel like you're the only person going through this. I was actually telling my therapist today, I feel like my life has changed in the sense of that, like, yeah, like this has become my life, but also like I'm navigating more towards people who also experience these things. And I feel like they're so much more vulnerable and I can share anything and it's a much more real conversation and like a real, you know what I'm saying here. So like how to combat loneliness, whether it be OCD, chronic illness, all these different things. I'm going to throw that to you first, Megan.
Vulnerability brings connection, and it can be really hard to share. We've talked about sharing with medical providers, but it's also hard sometimes to share with even people that know and love us best. But in my experience, it has been worth it. I think even when kind of like Jake's doctor, there hasn't been maybe like a all kind of conversation. It's like, wow, this was such a good conversation that followed from the sharing. Even if I'm longing for that, like I can't actually recall a time that someone has responded like truly insensitively. And in the process, even when I go, oh, well, that person can't enter in fully to this reality, even if I go realize that, I still have learned something about sharing. And I, over the years, like began to learn like who I could go to. There's a bit of an experimentation process, like, okay, who understands? And sometimes I'm surprised in the sharing, like in really beautiful ways, where I posted something on Facebook after I had surgery this spring. And all of a sudden it was the friend of a friend who was reaching out to me. And we had like such a good conversation. And I literally never would have considered her someone that I would just reach out to even try to have a conversation. All of a sudden there was connection there. I'll also say that like, even when I've thought that maybe I was doing like connected enough, okay, yeah, I've got this down, I know how to share about it, I realized that there were still maybe spaces to grow, and that's okay. Like learning to share with my fiance. I'm getting married on Saturday also, that's happening. But like learning to share with him about some of the things that I go through, like really learning to share even more in a more raw way. Like that's been an important part of growing together. And it's worth it, even if it's hard.
That's beautiful. I had the same experience when I posted an article about my rare disease. I think you're getting a lot of love for the wedding. Megan did say she was going to show up in a wedding dress and didn't, so I'm a little upset still about that. But we're very excited for her. But I had a very similar experience where I posted about like getting my diagnosis for the rare disease, and like my mom's teacher's aide from like school like commented that she had this condition, and like someone knew someone at Mayo Clinic that we could see it. Like you never know what kind of connection is gonna form out of that, and I think it's so beautiful. Mary.
Yeah, I just echoing what Megan said, you never know what's going to come up when you start sharing with people. And I think the biggest thing is that your story is a privilege. Whether you want to open up to them about your mental health or your physical health, it's not something that you have to disclose. It's a privileged piece of information for them to know that. So I hope that, everyone knows, like, as they're going through the world and when they choose to open up and be vulnerable, one, it's an incredibly brave thing to do, but that also you're giving them a gift to know you better.
That's awesome. Jake.
I don't think I have anything to add. I think that kind of.
I know. I was like, I don't know what Jake's gonna say here because they nailed it. Well, Jake, were you gonna say something?
No.
Okay, well, I will toss the next question to you as we're closing up. These are complicated conditions, right? And like it can be really hard when you have all of the above and you're experiencing and first getting diagnosed, and there's a lot that comes up with everything. Just generally, as someone with lived experience of both and the therapist, like what would you want to share with the audience before we close? Jake first.
Okay. I also kind of want to wrap in, I think in the chat, Beth had mentioned, do you consider OCD as being a chronic illness? And I mean, I think it can be, mental health diagnoses, you can get to a place where it's very managed and it's to a point where it's subclinical. Would it meet criteria if I went to the therapist today? I don't know. But for other people, it's more of an ebb and a flow. And I think the self-compassion piece without going down that road too or bringing that up too many times. Like I think self-compassion is really important, right? Like the piece around, okay, I'm going to do the best that I can today, and I'm going to manage this with what I've got at the time. And even if that doesn't take care of everything, that's also okay. Like it's okay to be human and not like perfectly get the treatment right. You can still do good ERP treatment, even if it's messy and you're making lots of mistakes. Like it still can be helpful. And so whether it's chronic physical illness or chronic mental illness, either category, being able to recognize, okay, I'm doing the best that I can today, and tomorrow could be different. It doesn't necessarily have to be worse. It doesn't necessarily have to be better, but it could be different. And that's something to look forward to too.
Yeah, definitely. Mary.
I don't think I can beat what Jake just said.
I know.
Can I just like quote everything he just said?
You want to do a ditto?
Yeah, I have to do a ditto here.
Ditto totally works. Megan, do you want to triple ditto or anything that you'd like to add?
Well, I do ditto, and I would just add what I shared with our SIG a few months ago about setting one's own speed limit. Like I'm thinking about this, truly like just a few days away from my wedding and realizing or remembering like I have a couple doctors that I do need to follow up with. And like, I know some of the things that are still challenging for me when it comes to OCD. And like this week, I'm choosing to focus on this. And that doesn't make me any less committed to recovery from OCD or taking care of my health. But sometimes like we can only hold so much in our brains and in our schedules at one time. And when we're dealing with something that is chronic, like we have to take the long view. And so like, it is okay. I know if I wait a little bit to follow up on that one referral, that doctor will still be there. And I can get back to that work of healing, like after I enjoy this week, like this season in my life. And it's okay. It's okay to do that, to take breaks so that we can like really live. Healing is important and it can allow us to live more freely and openly. But we don't need every moment to be focused on that when the rest of life is calling.
Ditto. That was great. Thank you. And thank you guys so much for taking the time to be here today, and also to the IOCDF for letting us have this conversation. Oh my gosh, what a wedding week. Ethan and Katie's wedding anniversary is this Monday, and Megan's getting married. Big week. Going off of that, for the closing announcements, there is another stream next week of the week of anniversary and weddings. It is not a wedding though. It is Ask the Experts, and that will be Wednesday, September 25th at noon Eastern time, I believe, for an hour. And to note too, the IOCDF is a donor-sponsored or donor-supported nonprofit organization. please consider making a donation at iocdf.org/donate. And yes, this is a really great way also with what the link that was just up there about live streams. I personally think the live streams are so educational, so helpful. So thank you all again, and hope you have a great night.